Hi, my name is Amy Robinson. I'm with Enlightened Healthy Living, and I am a wellness advocate for doTERRA essential oils.
I'm Dr. Carlos Santo, naturopathic physician in the state of Arizona and founder of Wellness One Nation.
We are really excited to be here today to be able to talk about women's hormones and being able to take a natural approach to those crazy ailments that we all get as women.
Very important we talk about this, Amy. Thanks for having me. Many complaints that women take to the doctor's office actually can be related to their hormones. Unfortunately, even if they are taken seriously and their hormones are addressed, they're usually put on some kind of synthetic hormone prescription. Now, if they're younger, they're going to be put on birth control pills. If they're beyond menopause, they're going to be put on traditional hormone replacement therapy, both of which come with significant side effects and problems. Most importantly, hormonal imbalances need to be first addressed at the source. Why the imbalance? A lot of times we're seeing this starting in adolescence with severe menstrual cramps and pain and abnormal bleeding patterns. And right from the get-go, women are put on hormones, but in the form of birth control pills. Now, there are extremely low levels of hormones in these pills, and so doctors assume that they're safe. Well, I'll tell you something. I've measured women in their mid and late 20s, as young as that, and when I've assessed their hormonal health, they had the same hormones of many of my women patients in their 60s, 70s, and beyond.
Oh, wow, that's not good.
That's significant, and it poses a significant problem for these women because their cycles are all over the board, or they don't have one at all, and many times their doctors tell them it's okay to not have a cycle. Or their hormones are so low that they can't sleep, they have severe anxiety, depression, skin problems. And it was strange because a lot of times these are the same symptoms that women are actually put on the pill for.
Yes, that's so true. That's so true.
And when you factor in lifestyle issues such as poor stress management, poor coping techniques for their stress.
Right.
Women are equally stressed as men, if not more, when trying to balance career as well as family and household. It is an issue, big time issue, and it gets swept under the carpet with more medications. Here, take something for sleep, take something for anxiety, take something for depression, take something for focus, such as Adderall. And now we've got walking, pharmacies every day, and we think we can just manage with these medications when all along what we're needing is just a little bit of perspective from the natural approach. So stress management techniques, you happen to know, of course, that my bias is yoga. Meditation, teaching people how to breathe again. It's just something we've lost connection with.
Yes.
People use coffee as a coping mechanism, either to get going in the morning or, frankly, to pick up their mood. Coffee can really lift a mood.
And since you brought up coffee, I have heard that coffee raises cortisol levels in the body.
Well, cortisol and adrenaline, yes, it does.
Or I guess caffeine. I should say caffeine, which can
Coffee's the biggest offending agent. And of course, it's what we dress the coffee with. We're adding tons of sugar, whether it's natural or artificial sugar, and dairy products, frankly, they're just generally not good for you. I'm an advocate of dairy when it's the proper type of dairy product without the hormones in it. And so we have this toxic load to the body. And then, of course, there's the liver. The liver is the number one sort of make or break organ of the body that's going to determine our level of healthy or unhealthy hormones. And the hormone that we beam in on, most importantly, is estrogen. Now, estrogen, of course, is a very important hormone for the reproductive cycle for women, but there's an unhealthy type of hormone, of estrogen hormone, that when it builds up is going to cause a host of problems. We see women, for instance, with cysts on their ovaries, polycystic ovarian syndrome, endometriosis, and again, a host of other problems, depression, anxiety, severe migraine, severe cystic acne, all related to these foreign estrogens known as xenoestrogens. What are the sources of these estrogens? Well, we find, of course, that we mentioned foods. If you're consuming foods or from livestock that were injected with these hormones, then they're going to build up in your body. Simple technique, read labels. Ask, where the food is coming from. If you can get it locally grown and know the farmer who brought you those foods, wonderful. Pesticides, yes, but we have less control over pesticides even when they're considered organic. We still can see pesticide residues on these foods, but the xenoestrogen load from pesticides is significantly lower than that which is in which animals are directly injected with these hormones. And then, of course, there's the issue of cosmetics. Most sunscreens are not suitable for the average human body, no less a small child. And the toxic load of these sunscreens from just the xenoestrogen perspective is so
Interesting.
significant. I think, my opinion is women are actually lowering their risk by not using sunscreen at all.
Wow.
Of most types of cancers, including cancers of the skin. So
Interesting.
again, being smart regarding what we're putting into our body, especially across the largest absorption organ of the body being the skin, it would be very prudent to do so.
Yeah, I think that most of us, including myself, didn't realize that, putting a topical lotion like that could throw off our endocrine system.
We think the skin is inert, and it's really not.
Yeah.
The skin is the most significant absorption organ of the body and absorption source of the body. Anything that goes on our skin enters our bloodstream directly and doesn't even get to the liver first to be processed. It'll first go to the cellular level and do its job before it even gets to the liver.
Right.
Yeah.
So it sounds like the liver in this whole, hormone scenario is very important, and it's very important to, maybe do a liver support. I know
No
that
question, and we have numerous ones. And what I would like you to do, as soon as I'm done talking about menopause right now, I would like you to perhaps give our group here today some practical suggestions on what they
Yeah.
can do to improve their liver's health.
Yeah.
If I can just finish on one topic here, and then
Sure.
I'm going to hand it over to you, and that's the topic of menopause. Menopause is what happens when the hormones during a certain time of a woman's life go below a critical level, at which time she's going to miss her cycle for a minimum of 6 to 12 months. After that time, typically a woman is considered to be in menopause. Now, many women can go through menopause naturally, not have to do anything at all. As long as she's leading a healthy lifestyle, keeping active, having a good nutrition and exercise program that's going to maintain healthy heart and healthy bones, she does not need to do anything at all. I'll be honest with you.
Oh, wow.
She shouldn't have typical menopausal complaints of hot flashes, night sweats, insomnia, severe mood swings. But in the cases where she does, we do have natural approaches that go stronger than just the herbal or even the essential oil approach. If a woman needs something stronger, she does not have to go with the conventional HRT or hormone replacement route. So many women don't want that. And the good news is we do have naturally compounded bioidentical hormones that many women are starting to learn about and ask their doctors about. Please tell us now what we can do from the essential oil perspective.
Okay, sure. So earlier I was just talking about the liver and how, it's going to be really important to support our liver. We'll talk about detox in another video, but just, using Zendocrine essential oil, which doTERRA produces, topically on the liver is very, very beneficial. Using phytoestrogen every day. I know for myself, the phytoestrogen that doTERRA provides really changed a lot of my crazy symptoms that I personally was going through. It took about 3 months, but it really helped to start fleshing out those estrogens that we get from the environment. And also, using an oil like geranium essential oil, which was able to bring up my progesterone levels. We also have an oil called Clary Calm, which is a blend of oils that really target, all of those crazy symptoms that we get as women, PMS, menopausal symptoms, and really just helps balance us out during that time of the month. And so a lot of different options when it comes to essential oils and how to use them.
That's really great. Well, I think we've given our group today, our female group today, maybe even for the men who are watching to help their wives or significant others, a little bit of a start here. But stay tuned because we're going to have a number of other really informative videos and we think you'll like them.
Yes, take care. Bye.
Bye.